The human body is a marvel of engineering, a complex interplay of bones, muscles, and joints that allows us to move, work, and play. But what happens when this intricate system is injured or affected by disease? That's where the power of medical imaging comes in, particularly musculoskeletal X-rays. These images provide a window into the skeletal system, revealing fractures, dislocations, and other abnormalities that may be causing pain, swelling, or limited mobility. Imagine a basketball player landing awkwardly after a jump shot, or a construction worker experiencing sudden back pain after lifting a heavy load. In these scenarios, an MSK X-ray can be the first step in diagnosing the problem. It allows healthcare providers to visualize the bones and joints, identify any damage, and determine the most appropriate course of treatment. From the emergency room to the orthopedic clinic, MSK X-rays are an indispensable tool for diagnosing a wide range of conditions. They are quick, painless, and relatively inexpensive, making them a readily accessible imaging modality. These images provide valuable information that guides treatment decisions, from conservative measures like rest and medication to more invasive procedures like surgery. But interpreting these images is not as simple as it seems. It requires a trained eye, a systematic approach, and a thorough understanding of anatomy and pathology. In the following sections, we'll delve deeper into the art of MSK X-ray interpretation, equipping you with the knowledge and skills to confidently analyze these images and provide the best possible care for your patients. In the world of medical imaging, two heads are often better than one, and two views are certainly better than one. When it comes to MSK X-rays, obtaining multiple views is crucial for accurate interpretation. Why? Because a single view provides a limited perspective, like looking at a sculpture from only one angle. Think of it this way. Imagine trying to understand the shape of a box by looking at just one side. You might think it's a square, but it could be a rectangle, or even a trapezoid. Similarly, a single X-ray view might miss a subtle fracture or dislocation that's clearly visible from a different angle. The standard practice for MSK X-rays is to obtain at least two views, an anterior-posterior view, where the X-ray beam passes from front to back, and a lateral view, where the beam passes from side to side. These orthogonal views provide a more complete picture of the anatomy, allowing for better visualization of the bones and joints. But it's not just about multiple views. Having multiple observers can also enhance accuracy. A fresh pair of eyes can often spot subtle findings that the primary interpreter might have missed, especially in complex cases. This is particularly important in teaching hospitals, where medical students, residents, and attending physicians often review images together, fostering a collaborative approach to diagnosis.
Ja,
Soft tissues, they can reveal a lot more than we sometimes give them credit for. When interpreting X-rays, don't just focus on the bones. Look at the surrounding soft tissues as well. Swelling, for instance, can indicate underlying fractures or infections. And sometimes unusual soft tissue shadows can point to more serious conditions. So always remember, soft tissues tell a story too. Analyzing fractures doesn't have to be daunting. Start by identifying the location of the fracture. Is it in the shaft, the metaphysis, or the epiphysis? Then, determine the type of fracture. Is it transverse, oblique, spiral, or comminuted? And don't forget to assess the alignment and displacement. By breaking it down into these steps, fracture analysis can be made much easier. Special cases and joint conditions require a bit more attention. Conditions like osteoarthritis, rheumatoid arthritis, and gout have distinct radiographic features. For instance, osteoarthritis often shows joint space narrowing and osteophyte formation. Rheumatoid arthritis may present with joint erosions and soft tissue swelling, and gout can show up as tophi or punched-out lesions. By recognizing these patterns, you can make more accurate diagnoses in special cases and joint conditions.